And usually we start with the numbers of confirmed cases. Worldwide, up till this morning, there were 92,782,402 confirmed cases. The number of those who died, passed away, since the beginning of this pandemic worldwide is 1,986,958. In Oman, we registered 178 confirmed cases yesterday, which takes our total number to 131,264 cases. Yesterday, 6,439 tests were done in Oman. The total number of tests we did since the beginning of this pandemic is 883,340. Those who were admitted to all our healthcare facilities in Oman yesterday were 9 patients. One of them to the intensive care unit, and the total number of patients in our healthcare facilities today, 51 patients, 21 of them in ICU. Death, unfortunately, there was 1 death yesterday, and the total number of deaths since the beginning is 1,509 individuals. Those who've recovered are more than 123,415 individuals. That takes the percentage to more than 94%. Yes, our numbers are much better than what they used to be. Yes, thanks to all of you who've been adhering to the healthy practice, to wearing your masks appropriately, and keeping your physical distance, and washing your hands or using hand sanitizers, and following the respiratory etiquettes by coughing or sneezing, whether in your elbow if you don't have tissues or in tissues. Our number came down. But it's not over yet. And I think all of you are following what's happening worldwide. All of you are aware of many countries who did excellent job in controlling the pandemic during the last fall, but winter came with festive seasons, with the New Year parties, with traveling, and the numbers are alarming worldwide. And we are worried in Oman that unless we continue doing the right things, unless each one of us feels a responsibility to protect him or herself, their loved one, their community, I'm worried that we might go back to what we were a few months ago. So I urge all of you to continue doing the right thing, to help us to continue reducing the pressure on our healthcare facilities and our staff who've been working for a year now, non-stop. And I'm grateful to all of them, and I cannot thank them enough. You all heard about the new strains, and unfortunately there are 3 of them now. And here I have to register a thank to the British health authorities who discovered the first strain. They have the facilities, and not only that, they alerted WHO and all of us about the new strain. Dr. Amal here, she said in Arabic about the strains and how viruses have always the potential for mutation and for new variant. It's not always bad news. Sometimes actually it's not in the interest of the virus, but unfortunately this time it is. And whenever there's a new strain, there are a few questions we ask ourselves in the healthcare and to the scientists. Firstly, the spread. Does the new strain change the way it spread? And unfortunately, yes. It's proven that the new strain, which was discovered first in UK, spread faster than the original one. And it had spread to more than 45 countries so far, and not all countries have the facilities to check for the new strain. Is it more severe than the original? As yet, Luckily, alhamdulillah, thank God, as yet there is no indication it's more severe than the original disease. Does it respond to the same treatment? As yet also there is no indication it doesn't. Yes, it does. Does it respond to the vaccines that are available? And at least we know from Pfizer's data yet, and it's the first vaccine that's been licensed, yes, it does respond to the same vaccine. But as you could see, we may have other variants who might completely behave differently and cause more havoc worldwide, which we've had enough of. So again, let us do the right thing and keep wearing our masks appropriately when required, keep our physical distance, stop the gathering. I heard about the people hugging and shaking hands and meeting in closed places in big crowds. And that's what the virus likes to see. And that's what happened in countries, and mainly in cold countries, where people start gathering indoors, not adhering to these instructions. Let me move from the virus and the new spreads, which I hope we will not see many of them, new strains, sorry, which I hope we will not see many of them, to vaccines and vaccination. As you are aware, we launched Covid-19 vaccine in Oman on the 27th of December. And because I am sure of the safety of the vaccine, I was the first person to receive the vaccine in Oman, and I can assure all of you, I'm doing well. I did not have any major side effects, neither did any one of the 20+ million worldwide who received the vaccine. Unfortunately, the rumors and the misinformations about the vaccines and the virus are spreading like fire everywhere. So I'm urging you all to get your information from the reliable sources in Oman, the website of the Ministry of Health, WHO, CDC, and similar organizations worldwide. Do not listen or circulate rumors, please. The only limiting factor for the vaccine at the moment, it's not the price. Yes, they are expensive, but I'm grateful to His Majesty and his government. We do have the fund to buy the vaccine. It's the production of the vaccine. And unfortunately also certain companies in certain countries, they are not allowed to export the vaccines. And here it's for international viewers. There's no point of Oman vaccinating everybody in Oman if we have the capability and forgetting about the rest, because these viruses, unless the vaccine distributed equally and with equity worldwide, it will continue to circulate this virus, and the economic and social impact will never stop. WHO, and we are members of not only WHO but the COVAX, which is the World Alliance for the Vaccine, with about 186 countries. The aim is to distribute the vaccine equally to both low, middle, and high-income countries. But up till today, less than 45 countries started the vaccine programs. Only 1 or 2 countries are from the low income. The rest are high income or very high income, actually, some of them. The other questions, when you take the vaccine, do you still need to adhere to the healthy practices that I've mentioned? What we know up till now, the vaccine will protect you from having the disease, or severe disease at least. But unfortunately, this virus can still live in your upper respiratory tract, which means if you are carrying the virus, and we know that hundreds of thousands carry the virus with no symptoms, those who are vaccinated, they might be carrying the virus without symptoms, so they need still to wear the masks, keep their physical distance, keep their hand hygienes to protect others. I said several times, and I'm repeating it today, and I know some of you probably fed up with us in healthcare repeating things over and over, but I can tell you the virus is not fed up of spreading. It is still spreading, it's still causing misery and death everywhere. But each one of us should consider him or herself carrying the virus. Therefore, wear the mask, keep your distance to protect others. I don't think any of us intentionally would like to pass the virus to somebody, whether somebody they love, whether there's somebody they met, whether somebody in a restaurant, because that somebody might, if themselves don't have chronic diseases, that person and you can pass the virus to somebody who might end up in the intensive care unit or, God forbid, dead. Do you want honestly to carry that guilt through your life, causing somebody's death? I don't think so. So, yes, taking the vaccine is very good when it's available. It will protect you. But as yet, we don't know, or we know actually, it might not prevent you from passing the virus to others. I've mentioned that we launched the campaign on 27th of December. We received so far only 27,300 doses of Pfizer vaccine, and we hope to get more. Of that, we already used 22,749. Our target to cover 60% of people in Oman with vaccination, and this is through stages. And stage 1 is 20%. And usually, like not only in Oman, in many other countries, these 20% are for those who are frontline, whether in the healthcare system or other sectors, and for people who have chronic diseases, which means that if they had the virus, it might be life-threatening. And I'm very glad to say that we've managed already to cover with the first dose 82% of our target of the first 20%. This is with the first dose, of course. And our intention to give the second dose as recommended by the manufacturer, which is within 21 to 28 days of the first dose. As yet, there are only 3 companies which have been licensed, at least in the countries that we deal with. And we hope to get, and we did book, more than 2,800,000 doses, but this will take time. It might be that, we are spreading worldwide the vaccination across this year. So yes, our numbers are much better thanks to all of you. There are days when we had zero death, alhamdulillah, and yesterday there was only 1 death. But as I said, look at what's happening worldwide. This virus doesn't require visa, doesn't require a ticket. It travels with you. It ends with you. It can end with you if you are carrying the virus. You could actually get rid of this virus and not allowing it to go to somebody else. So, yes, we are on our guards. We are definitely making coming to Oman possible, but the 7 days quarantine, the PCR test before coming to Oman, PCR test when you arrive to Oman, the bracelets that they put on your arm when you arrive to the country, the test on the 8th day, and if you are negative, the quarantine will be over, will continue. Unfortunately, and I think some of you have seen this, many of those who came to Oman, whether Omanis or from our colleagues, the expats, they thought this bracelet is just for a show. And some of them, believe it or not, they cut it and they threw it away because there was no penalty, no fines against that. There is now. And if you are provided with this and you don't return it in the designated time to one of the healthcare facilities, the fine now is 1,000 riyal. It's not, we are not putting fines or regulation because we like to punish people. No, it's a deterrent. And I hope it will stop the few of you, the majority are doing an excellent job. And I'm always repeating that we are grateful to your cooperation and help. But there are still those, unfortunately, who, I don't know why, but they're careless. They don't believe the virus will affect them. If it doesn't affect you, it might affect your parents, your grandparents, your siblings, your brothers who might be diabetic or have kidney disease, and it did happen. So again, it is in our hands to reduce the burden of this disease on our healthcare facilities. It is in our hands to control this disease so that we could go to semi-normal life. Going back to normal is not going to be very soon, unfortunately. And some of you following WHO press conferences, and you've heard that WHO predict that the first quarter, at least, of this year might be worse than last year. And they do have reasons to be alarmed. In many countries in the Northern Hemisphere, hospitals reach their capacity. In many countries, or in some countries, which are very rich and they have almost unlimited resources, they don't have enough oxygen to treat their patients. Can you imagine that? Do you want us to go back to complete lockdown? Do you want us to go back to all the restrictions that we hope they will be in our past? No, you don't. And for that reason, I'm reminding you, I'm urging you to continue doing the right thing. I wish you all well, and Happy New Year for all of you, and I hope this year will prove to be better than last year. I hope that will be the case, even though the beginning from this pandemic, the beginning of this year worldwide, has not been great. But at least the good news, we do have the vaccines now. Many companies are in the pipeline. We do have the knowledge how to prevent this virus and how to treat those who are unfortunate to have it better. But the best way to stop this disease is prevention. And that's not in the hands of the Supreme Committee or the Ministry of Health or healthcare staff. That is our responsibility collectively. So let's do it together. Let's help Oman first, worldwide, reducing the burden of this disease. Thank you very much.